A few seconds.
Yes. Okay.
You got that notification too, right?
Yep, I did. And this time I've made notes as well, so I don't mess up the translation.
You never mess up anything. Oh, it says the movement studio is
Too,
right
right?
now. Oh.
Yep, I did.
Okay. Hello,
Don't
Dr.
mess up the
Harini.
translation.
It's so good to see you.
You never mess up anything.
Oh my.
Oh god, there's a feedback.
Okay.
Too, right now?
Oh.
Yep, okay. So good to see you. You never mess up anything.
Oh my.
Oh god, there's a feedback.
That's so
Too, right now?
Oh.
Yep, I have no idea how that's happening either.
Okay, this happens every single time. I think it opens automatically.
Maybe.
Yes.
Okay.
Okay. So welcome to the live space of the Movement Studio, Dr. Harini.
Thank you, Prerna.
It's good to see you again.
Yes.
And to the viewers too, I hope there was a lot of takeaway from the first 2 episodes that we did about the importance of movement and dance and the amount of activities required for different age groups and what to expect from such courses, the importance of strength and conditioning. We talk specifically about children, just to reiterate that again. And today's topic, as the subject clearly indicates in our poster, is about common dance injuries, the prevention, causes, and how to treat them. Joining us is Dr. Harini, who is going to introduce herself in 2 lines so you know about her background.
Hi. Thank you again for having me here, Prerna. I'm Dr. Harini, and I'm a sports and exercise physician. I've done my master's in the UK, and I have a special interest, and I've done dance medicine as well. I have an interest in that, as well as sports psychology, because I believe that you cannot have physical wellness without mental wellness. So that's a bit about me.
I don't think we can have anyone better than Dr. Harini speaking on this subject, because there are a lot of people out there who know about the body and sports and strength and conditioning, but to specifically from the dance point of view, so dance medicine, and then the psychological perspective too about the whole training thing. Dr. Harini, I think, is the best person. So we'll just please note that there will be a translation in Hindi and Tamil, a brief summary of the entire conversation at the end of this live talk. So Dr. Harini, the first question. So say ballet, in the context of ballet, we start training at 3 or 4 years of age. So a child who trains in ballet versus a child who does not go to ballet, there are differences in the way their body changes. People see that and then people come and say, oh, the strength is there and the grace is there and the posture is there. So that's one of the reasons why ballet is loved everywhere by almost all parents. So what are the different physiological, anatomical adaptations that happen in a child's body? In layman terms, how does the body of a child change when they train in ballet?
That's very important for anyone who's looking to put their children in ballet. So it's something that they need to understand. Firstly, the large chunk of the research that is available right now shows that ballet actually makes things better for children when it comes to both a physiological and a structural perspective. So the first thing that you could very easily relate to is balance. So with kids who have trained in ballet, so I'm not talking about you put your kid in at 3 years of age and you're expecting that at 4 it's not going to happen. What I mean is when a kid is training in ballet for a couple of years, usually most of these research, it talks about at least a period of 3 to 4 years. But I mean, you will be able to see minor differences within a couple of months, but the significant amount of changes you see over a couple of years. So when you start putting your kid in from a very early age, by the time they hit their teens or even like maybe 5-6 years into training, you start seeing them, having a better proprioception. So proprioception is this sense of location. So it's like, for example, when you're doing something, when you say you're cooking, you don't really have to turn and look to take your jar of salt or a jar of sugar. Your brain just knows where it is. You can blindly put your hand out and pick it up. That comes with time. And that is your body's sense of location. Your body is like, I know I'm here. I don't really have to look to reach out and pick up something. I don't really have to look to know that when I walk in this pathway, I'm going to hit a table, I'm going to hit a chair. Which is why when you're in a familiar surrounding, even in the dark, you are able to move around without really banging into stuff. So that is something that really improves for kids who are in ballet. Proprioception improves really well, which compared to a control study, a control group is where people are not in ballet. So compared to that, if they found that proprioception improves like really well, balance improves a lot, and synchronization, where you are able to do things in sync with, maybe with a couple of other people or even with yourself. Your right brain and your left brain are in sync. These are all, when I'm saying it in this way, you're like, okay, what is my kid going to do with all of these things? But these are all so important for your kids' growth, physically and mentally, like we spoke before, because especially right brain, left brain synchronization can boost your kids' brain development, can boost your kids' memory power, can, cognition, everything. So that is one of the primary things when it comes to differences. Apart from that, when we're looking at structural changes, this again happens in the long run. You would usually find it in pre-professional dancers, maybe, but the adaptation starts young. Is that their external rotation? Basically, you know how you do your you move your legs out. What I'm just trying to make it really simple for people. So you have your 5-point stance. So when you do all of those movements, your external rotation of your hip, there is a much better angle of rotation. So that is one of the first things that people notice. Second thing is your spine. It gives you this beautiful gracious posture, the thing that you were just talking about, posture and grace. There's better lordosis. There isn't too much of a person who's into ballet doesn't really slouch much. You see them holding themselves tall and high, and that will boost a person's confidence to various levels. So these are all physical changes that you can see. In addition to that, there are a few problematic changes as well, where you end up having a little bit of weakness in your talocalcaneal ligaments, as in your ligaments in your feet, a little weakness in the ligaments of your knee. These are all things that are on the downside, but on the upside, you just have this poise, to put it simply. Your kid has so much of grace and poise. So
and stronger body. So the ligament that weakness that you're talking about is again overuse, because so much of ballet is about footwork and
exactly.
So before going forward, I'd like to make it clear that injuries are very, very common in any sport. It cannot be avoided. It cannot be done away with. So the only way you can do away injuries completely for your child is to just stop them from moving. And that just takes away so much from the kid. So be it any sport, injuries are just going to be there. In this episode, we're just going to focus on injuries related to dance, specifically from ballet and contemporary dance. So would you like to add something to it, Dr. Harini?
Just that on the disclaimer you just said, dance is a sport as well. It's an aesthetic sport.
Yeah. So yeah, injuries are bound to happen, but it's all part and parcel of it. Yeah. So we see the ups, and when we keep the downs in perspective as well, and keep a clear head about it. Proprioception, as Dr. Harini says, it's about a sense of our position relative to our environment, right?
Yes.
So from here, we move on to common injuries from ballet, and then we talk about common injuries from contemporary dance. So what are the most common injuries that happen in ballet?
So we could actually look at them side by side. So ballet and contemporary dance, they're actually significantly different, if, for people who are in here. So you notice that the movement patterns are different. When it comes to contemporary, you don't really have too much of point work, right? So, and because of that itself determines which injuries are more. So because of that, what happens is when it comes to classical ballet, the maximum amount of injury you notice are around the ankle and the feet, the joints of the feet. When it comes to contemporary dance, though, you see a lot of injury around the thigh muscles. It's not joint related anymore, it's muscular. So you have a lot on the thigh muscles, a lot on the calf muscles. And another thing is about spine. When it comes to classical ballet, you have a lot of injury around your thoracic spine and your lumbar spine. But when it comes to contemporary, your spine really isn't affected that much as compared to classical ballet. Whereas your entire lower limb, and most significantly your knee joint, gets affected so badly. So,
okay, so these are the common locations where injuries usually happen in dance, based on a study that has based on
multiple studies actually.
Studies that have been done.
Yes.
So,
And the other thing, sorry, I'm really sorry. The other thing is in classical dance, you have a lot of tendinopathies, basically because it's joints that are involved.
yeah.
And when it comes to contemporary dance, you actually only have strains or sprains. So it's actually, when you look at it that way, it sounds like contemporary dance is a lot safer, but in reality, they both have their own pros
Yeah.
and cons.
Ultimately, it comes down to the kind of training you do, the kind of teacher you're training with, the strength and conditioning and cross training routines you follow, and all the
Exactly.
preventive measures you take to make sure you minimize this. But step one is awareness, to know
Yes.
what happens and what can happen, and then we
Yes.
work backwards from there. So, as Dr. Harini said, in classical ballet, because of the emphasis on the ankle, especially, we have a lot of injuries. Common injuries are around the ankle and feet, joints of the feet, thoracic and lumbar, the chest and the lower back part of the spine, and tendinopathies because tendons are involved at the joints. And in contemporary dance, it's the thigh muscles, calves, knee joint, and mostly strains and sprains, which is muscular rather than tendon issues. Okay, this is very interesting. I would like to add that contemporary dance evolved as a necessity kind of, but also because dancers wanted to break away from the rigor and not the rigor, but the rigid structure of ballet. So contemporary dance can be very rigorous too, but ballet, as we know, is considered one of the most difficult sports in the world. Contemporary dance and modern dance is also very mindful of each dancer's body and the and a good teacher will work their way around the student's body. We do that in ballet as well now, since there's more awareness and research. But contemporary and modern dance definitely takes that a lot into account, because it does not have as much structure as ballet does. There's no like set way of doing it. So there you go about modern and contemporary. What are the usual causes of these injuries?
Okay, so first thing that we need to remember is that most ballet dancers, they can't really remember when an injury took place for them. But that is because it's not a momentary thing. It's not an acute thing. It doesn't just happen. You don't fall and I mean, it does happen once in a while. People do fall and they hurt themselves, but that is not usually how it happens. Most of the injuries in dance are because of overuse and overtraining. We discussed about that in the last session. So there is so much of training that happens, especially around classical ballet. Like you said, it's pretty rigid, and there is so much of training that goes into it. And what contributes to this as well is the requirement for the ballet dancer to look aesthetically pleasing. So because of that, what is a common trend that we notice is people try to go into calorie deficits. Instead of trying to lower their weight in a healthy manner, they're like, okay, by the next performance, I need to, go down a weight group. So it's almost like when you're in MMA and you want to lose a weight category. But instead of using diuretics and stuff, people in ballet, because they can't afford to lose the way they look, so they want to do it in a calorie deficit, and they just ruin their health by doing that. There are people who try to stay way below their normal BMI levels, and it's just unhealthy. And what commonly happens because of this is this syndrome called REDS, relative energy deficiency syndrome. And this is where, because of this calorie deficit, because of long-term calorie deficit, because what happens is the hormones in our body, they just go for a toss. Especially for women. It used to be called female athlete triad, but then people have started noticing it in male athletes as well, which is why it's been renamed as REDS. So it just puts all the hormones in our body into this huge jumble. And because of which, what again happens is, for women especially, you end up with menstrual problems, menstrual irregularities, PCOD, so many things, which again leads to weak bones. And you can imagine what kind of a horrifying thing weak bones is for someone who is in ballet. So, I mean, because you're already prone to so much injury and you do not want to be putting your bones into a brittle state, causing them to fracture that much more easily. So without realizing it, these athletes, these artists, they are literally putting their career into this vicious cycle. And that has been noticed, that is by research, that has also been noticed to be one of the very common reasons for injury in ballet, apart from just the overtraining, apart from way too many leaps and jumps. And for men in ballet, there is a lot of shoulder injury. I did not mention that in the previous thing, but because most of the, the movement patterns for men in ballet is lifting. So, it's shoulder injuries, and that is again very common, which is again worsened by this, because imagine what happens. You are as a guy, you have reds and you are weak and you aren't able to take the female athlete's weight. You drop her and you hurt yourself, you hurt her also, you completely ruin the entire performance. But that is something that even as athletes, people don't really realize. They don't think about it. For them, it's about looking aesthetically good in that performance.
Okay. So do you have any other reasons for why injuries happen commonly in ballet dancers?
This is about the most common ones, yes.
Okay. So as far as remembering when an injury happens, so let's talk about children again. So what is the age group around which studies were done to determine injuries and causes and everything?
The thing is, the injury profiles usually don't start in children. Okay. But the causes for the injury, they start when they are children. Okay. The injury themselves, that the actual incident, it happens much later, maybe in their 16s, 17s. That's the age group where it's very common. And it becomes more frequent as people age. Higher the age, more frequent the injuries. But the cause for it, the overtraining that leads to it, the dietary changes that leads to it, all of this start much younger.
Okay. So the important thing here is, so would you say that you can't remember when an injury happens mostly because it happens over time. But if parents are very aware and teach children to develop some awareness of pain, whether it's soreness or whether it's actually like troubling pain, and keep a record of it, then it becomes easier to understand at which point this could have started, what changes happened around that time that led to it.
In fact, it could even help to preemptively prepare for it, to avoid it, to prehabilitate, to put it simply.
Okay.
When your kid starts becoming aware with their body, so this is one of the most primary things I always ask most of my athletes to do when they have an injury, is get in sync with your body. Spend some time every day, spend like 5-10 minutes every day, maybe meditate or just spend some time in silence and observe your own body. Yeah. Observe the pains, observe the creaks, observe your breathing, observe your heart rate.
Okay, so the mind-body connection.
Exactly.
Which is something that is being explored a lot lately, even in general strength and conditioning across sports.
There's nothing that can help you as much as your own body can.
Yeah. And an understanding and the connection between the mind and the body. Okay. So the overuse and overtraining that you talked about, you've talked a lot about this in our last episode. So we'll keep that short, that part of discussion short. So overtraining, as the word states, is just training too much, the same movements again and again, which leads to weakness in those muscles and weakness in the other muscles too, which are not being used. And it's related to overuse injuries, which is, again, I think I said the same thing together, both things together. So to avoid this, parents need to understand how much activity is required for that age group of kids, how much training is overtraining, and is leading to an overuse of their physical capabilities. So again, it comes down to parental awareness, to the coach's awareness, and sense of responsibility about training children.
And to avoid specialization.
And to avoid specialization, very important part. Specialization is when you focus on only one sport and you start too early. So experts agree that specializing in any sports too early before a child hits puberty is not in the best interest of the kid. It's not safe, leads to injuries more often than not. Am I right?
Perfect.
So, and the calorie deficit part is very interesting because for many reasons. One is the pressure artists put on themselves, even children put on themselves, because they want to perform a certain way, and because the ballerina, typical representation of a ballerina in their minds is so typical, like very thin and wiry. And also because around that time, the messaging from the society has started to enter their heads when they're 10 and 11, and they've already started looking at their body as too thin, too fat, especially little girls.
Yes.
Do that. And sometimes also, in some cases, not all, there's pressure from parents too. Okay, so but calorie deficit is one of those factors of all the factors that we discussed that is more easily addressed than the others.
Yes.
It's more visible, more tangible, and can be more easily addressed. Just
While it does seem that way, there is also a very very complicated psychological aspect to it.
Mhm,
So while it could be very easy for a parent or a coach to tell their child, see, you're not supposed to be doing this,
mhm,
but you really need to break down the body image the child has of themselves,
mhm.
and
Or
that
what
is where it
image
gets a
they
bit
aspire to. Yeah,
yes,
teach them what a healthy body looks like and
yes.
feels like. And there's a very interesting story around one of the most famous ballerinas in the world is Miss T. Copeland.
Mhm.
She's African American, and she was actually she is a child prodigy. She took up ballet really late, around I think 11 years of age, which is considered very late in ballet to be professional in it. And around 13, I think, when she applied to professional schools, she was actually rejected, stating that the letter stated that her body was not the type that ballet, the professional companies want it to be. So eventually she got accepted by one of the schools. And there's a video in which she's collaborated with Under Armour. I
Mhm.
will what I want. There's a whole series of it. And she reads out that letter in her voice while she goes on point, and then she starts dancing. So that's a lovely video. There's also a documentary where she talks about how she was rejected for her body type. She's muscular. She's always been on the muscular side. So children can look a certain way. They can still dance ballet. And there is responsible teaching and responsible coaching and parental guidance can help children really get there without compromising their mental and physical health in the long run. So that is my point. That there's no one way to look when you are a sports person. Okay. So yes, so we've already discussed a little bit about preventive strategies, uh, where you started with prehab. We'll
Mhm.
discuss a few more that Dr. Harini wishes to share, but I would like you to talk a little bit more about what prehab means.
Okay, so prehab. Okay, this is a word that's actually been thrown around a lot lately. So people may not really be familiar with it. Prehabilitation literally means okay, let's start with rehab. Rehabilitation is what happens after you have an injury. You get an injury and then you fix yourself and then you rehabilitate yourself to get back into sport. But prehab is where you are mindful of an injury that could potentially happen and you start rehabilitating your body before it even happens. You start looking at what are the quirks, what are the things that you're missing out, why is your body on the path to that particular injury,
Mhm.
and then you work on that beforehand and prevent the injury from even happening. So it's actually a preventive strategy, and rehabilitation is so important.
Okay.
No.
So
Yeah.
one of the steps for prehab, because it makes logical sense to me, not because I've studied prehab,
Mhm.
would be assessments, right?
Regular assessments, yes.
Regular assessments. Would you know how that would look like for children younger than 10 years of age? Is it required? Do teachers need to do
It
it?
is
Are there
definitely,
resources?
it is definitely required, and it doesn't matter what age. If your kid is physically active, you better keep assessing the kid. So when you look at kids under the age of 10, you can't really put them into a structured assessment group. I mean, you could maybe beyond the age of 8, but below that, you can't really put them into a structured assessment group because their movement patterns aren't structured yet. Like we spoke in the last two sessions, it's more of free movement,
Yeah.
more of free play. So what you need to be doing is what we discussed a little while ago, is where you let the kid observe their body. You observe the kid's body. You observe the way they walk, the way they come and sit. I mean, you can pull out so much. A kid who's normally walking suddenly starts having this one in a tiny bit of a limp. I'm not saying a significant limp where you can obviously see it. But if as a parent you are observing your kid on a daily basis, you pick up those things very quickly.
Mhm.
So you need to keep a watch out for that. And you need to keep a watch out for when your kid says there's pain. These are all like basic at home assessments that you can do. And when your kid does have those things, maybe ask them to jump, maybe ask them to run, ask them to do, what if it's an upper body thing, ask them to maybe lift up something. And you don't make it look like a test. Just make them do things around the house. And if they are unable to do that, you know that there's something wrong. Things that they normally do, there's something wrong. So that is the most basic form of assessment that you can do at home.
Okay. So in this context, I don't know if this is true and can be applied across India. So I want this conversation to be more in the Indian context,
Yes.
because things are very different in America and Europe, and India is our reality is just so different.
Mhm.
So what I feel is that if my 8-year-old student goes to an ortho,
Mhm.
and because the child has had consistent pain for a while and I can't figure out where it's coming from, so I say go get an assessment done. And mostly it's like they just dismiss the kid's pain. They don't really, I don't like the use of the word dismiss here, but on the whole, that's what happens. So to keep the conversation shorter, they dismiss it, and I don't get clear answers on why that could have happened. So, what is going to fill that gap over there? Like, what can parents and teachers do?
Okay, so this is a bit of a tricky, also controversial question for me. I no offense to any of the orthopedicians out there, but the thing that happens is a lot of times we tend to attribute pain in children to growth spurts.
Okay.
This is something that I have noticed a lot of orthopedicians do, and majority of the time it is growth spurts. However, there are, a small percentage of cases where it could be an injury, where it could be a process to an injury. So that requires assessment. And like you said, people do, I mean, when you are in a setup like India, where you have like a large number of patients, and you've got to see one patient in like 2 minutes and stuff like that, it does happen that sometimes people do overlook. Even I do. It does happen. And I wouldn't really say it's a wrong thing, although we could take a few more minutes and look into stuff, but I wouldn't say it's a wrong thing. What would be a better approach, though, would be is to take the kid to a pediatric orthopedician rather. Don't put them to a regular orthopedician, point A, if your choice is an orthopedician. Or you could send the kid to a physiotherapist, because when it's a physiotherapist, they have the time, to, do a thorough assessment. So you could send the kid to a physiotherapist, or you could always send the kid to a sports physician. Because it's our job as a physiotherapist and as a sports physician, it is our job to assume that every pain is a subtle injury, is a strain, is a sprain. Unlike orthopedicians who are mostly on the lookout for massive injuries, where minor injuries are just, for them, it is something that the physiotherapist takes care of, a physical therapist takes care of.
Okay. So a physiotherapist or a sports physician is a more sensible approach at this point.
Yes.
Okay. I really think the government, or maybe even on a private level, studios that take ballet seriously could get together and fund for specialists to work exclusively with dancers.
Definitely. You could, on that note, studios could have tie-ups with therapists, with the physicians. Actually, when you do that and you put a tie-up with, say, an orthopedician, they will be able to, understand the process that each child goes through. So they will be more mindful, more aware of if that kid is going to get an injury or not, rather than, just seeing one kid random among 100 in a clinic. If you're going to be looking at a list of ballet dancers, you're going to look at the dancers only. Your mind is going to be more tuned to picking up those injuries. It's just how the human brain works. So,
True.
yeah.
The tie-up makes sense. Okay, so we also talked about the mind-body connection, which is as important in adults as it is in children. Although I believe the approach to teaching it has to be different, because if you're just going to tell a child to lie down and breathe in for 4 counts and breathe out for 7 counts,
It's going to get bored.
you are so dead.
Yes, you are.
It's not going to happen. So,
yes.
So mind-body connection in children, what would that look like? Do you have any ideas?
Okay, so mind-body connection in children, like you said, we can't really ask them to meditate. We can't do that. But what we could do is, at the end of a day, you could do like this family thing. This is just off the top of my head, a family thing where we all sit down and we like take a moment and we start describing what our day felt like, and we start describing what the thoughts in our mind are like. Take a few minutes. As parents, you don't really need to tell everything to your children, but just do an initiative. Get your child excited to start describing their body. Get your children excited to start describing any pains they have, anything new. Do you feel something new in your body? Do you feel a tingle today? Do you feel, some kind of a stretch? Do you feel anything? But, it should be a fun conversation, because with kids, you can't really expect them, like you said, you can't really expect them to understand what's going on with their body, but they still need to be able to tell you when something happens. So it needs to be a fun conversation for them. And if doing it every day is going to make your kid bored, because you know your kid best, this is just a suggestion, make it a weekly thing. but just make it a routine thing where the kid knows, okay, I can go and tell my mom something's off. I have this session today and I'm going to tell my mom today this happened to me, things like that.
Okay, that makes sense. On that note, I would like to add that when we talk about mind-body connection and meditation and mindfulness, it's mostly about getting out of our heads and into our bodies. So you get out of all your thoughts and excessive feelings that you have as thoughts running in your head, or the overwhelming feelings that you have. Disconnect from all the stories of your past and worries about the future. So you basically get out of your head and into your body, which means you bring more awareness to all five senses. So if the core of that mindfulness is understood, that it's more about getting out of the head into your body, connecting with all five senses, that it itself initiates a whole mind-body connection. You become more aware of what is going on. There was one exercise I remember that was done when I was a child at school. This was at school, where they would ask us to just close our eyes and imagine every single part of our body, starting from the toes, from the bottom up. And it's like you're running a very gentle brush across all the surfaces, or you're stilling even the movements you don't feel. You're trying to still one part of your body at a time, moving from down to up. So that automatically helps. It's a meditative exercise. And that brings a lot of awareness to
that is actually amazing.
To possible injuries, like to possible pain or imbalances, not even injuries, because imbalances in the body eventually lead to something going on.
So true.
Yeah. And I think children are smarter than we give them credit for. So I think when we introduce a new idea and introduce in ways that are acceptable to them and understandable by them, they really engage in it.
They pick up on it, and you might be actually surprised to see them bringing more ideas to you.
Yes.
So
yes.
we just need to be open to them.
Yeah, it's like I want to do a show and I leave and I have to write a script for it. So I tell the kids, even the 6-year-olds, like, come up with a script. Tell me like the wildest ideas you have, just tell me.
I know.
And some of those are so good, I actually incorporate it or like let them develop it.
The only thing we need to do as adults is just keep our ears and eyes open to those kids. Yes. And they're going to show us a whole new world.
Yes. To listen to children, I believe it's very important to listen to children. So assessments are an important part of training, even for children. And like you said, before 8 years of age, because it's mostly free movement, so it's hard to have any structured assessments. But when it comes to ballet training, a lot of people start out very early. Even sometimes very complex movements are taught to the more advanced kids by the time they're 6 or 7 and 8 years old.
So true, yes.
That is a sort of specialization, isn't it?
It is very much sort of specialization. So when I did speak about free movement, now that is what we ideally have to be doing. But what in reality is happening is, like you said, for ballet at an age of 10 or 11 is very late. People start at 5 when they're going into professional ballet. So by even say 6 or 7, they are very much structured, very much specialized. Although it's not really advisable, they're very much specialized. So in that case, those are kids you can have a structural assessment for, but and they are kids who have been in that coaching environment. They're nearly pre-elite. They're pre-elite athletes. So you can actually look at them as athletes. You can actually assess them as athletes. In which case, ideally a ballet school should have assessments every 3 months to see the fitness levels, to see the nutrition levels, to see how the movement pattern, the range of movements, everything. So that it would be a very comprehensive assessment, which would be done by a physical therapist or a sports physician. But you can do that in that setup.
Yeah. And that setup means this is a child that's preparing to go on an international stage, on a very professional stage. But I think most parents and most dancers are not regularly looking at it at that professional level. So it's more recreational, doing shows every year, getting their certification exams and stuff. So for them, which is like majority of the children that I see and parents that I see, this is as a dance teacher, I would say, to keep these very important things in mind about early specialization. Do you really need it? Does your child really need it if you don't have such dreams, or if they've not been encouraged as like, what is the word for it? Like, a born star for ballet.
A prodigy.
So, A prodigy, yeah. So do they really need this kind of rigor if they're not that much into ballet and they just want to do ballet recreationally and enjoy it while still developing that grace and strength? So the conversation that we are having now and I've had previously, it really applies to such students. We were talking about the steps to prevent.
Yes.
So prehab, mind-body connection, and regular assessments. Okay, if you have anything to add, feel free.
Mindfulness, that's it, nothing else.
Okay. So injuries, once they happen, they tend to recur. They happen again. So what is the physical and psychological perspective of this recurrence of injuries?
Okay. So first thing is when it happens for the first time, most kids, they tend to regress. They tend to go into this cocoon and they tend to develop a fear for training again. And more than actually rehabilitating the injury itself, which is actually the easier aspect. You could rehabilitate the injury pretty easily, but rehabilitating their mindset to go back out there and do a jump, to go back out there and, get on the floor again. That is where the actual work lies in. They will have a fear. So whatever was the movement that caused that injury, like we discussed before, it probably wasn't that particular incident alone. Yeah. There was a slew of incidents that happened before it, but that incident is going to be in that kid's mind for always. And the kid's always going to be scared of that until we work on it. So we need to slowly help that kid to come out of that fear. It's almost like a progression, like we do in strength and conditioning, where we start from basics and then we slowly load. So you will have to do that with that kid as well when they rehabilitate from a mind perspective. So you'll again have to, it kind of will work on both ways, because the kids had an injury, the kids just rehabilitated, they're just coming back on floor. So you don't want to load them physically as well, but that, progression will also help them come back mentally.
Okay. So progressing them back to that movement which caused injury in the first place.
Yes.
And what role does sports psychology play in it?
A lot. So like I just said, they're going to have that fear, they're going to have an anxiety. They might even develop performance anxiety. It depends if their injury was during rehearsal, was during just a regular practice, or was during a performance. And they would develop performance anxiety. It could be during any of these three, but they could still have this fear like, okay, I'm going on stage tomorrow. What if I break my ankle again? And that could ruin things for like the entire team.
Yeah.
So those are
breakdowns happen before performances all the time, and they don't even have to be injured in order for that to happen.
Exactly. There's so much of fear. So even in general, there is so much of sports psychology work that needs to be done with the kids to develop their confidence, to develop their sense of self, their confidence in themselves, all of this. And you cannot disregard the role of your mind, your psyche, when it comes to rehabilitating from an injury. Because when it comes to you've had an injury, you've had, say, an ankle strain, a tendonitis, something. You'd be like icing, you'd be resting, and then you'll slowly start stretching. You'd go back into strengthening the joint. You'd slowly bring in plyometrics. That's the whole process. But all of this is like relatively easy compared to what happens in your mind, because when you put that kid out from rest to start stretching again, the kid's going to have a fear. When you shift that kid from stretching to going into strength training, the kid's going to have another fear. And it's like it could fall back like a domino anytime. You would have spent like a month, you would have spent a couple of months working on that child, and bang, one small incident and the kid's back to square one. So you need to be mindful of that. And like we spoke before, the coach, the athlete, and the parent, they all need to be in sync, especially in conditions like this.
Okay. Yeah. So teaching children healthy coping strategies, again, as prehab too, why not for the mind as well?
Very much, yes.
Okay. This is very interesting. Okay, so that was all the questions from my end. Dr. Harini, do you have anything else to add to these questions around the physiological, anatomical adaptations, common injuries, causes of these injuries, and preventive measures?
I think we've kind of gone around the whole thing. Yes.
Okay, do you think this is going to be harder to translate today?
It might be. Yes, I'm actually thinking how I'm going to do that myself.
It's yeah, because we used a lot of terms that
I don't think we can really substitute those terms.
We can't.
Yes,
but let's give it a shot. Why don't you go first in Tamil?
Okay, so வணக்கம். இன்னைக்கு நாங்க பேசினது வந்து இத்தனை நாளா கொஞ்சம் ஜென்ரலா பேசிட்டு இருந்தோம் குழந்தைங்க விளையாடுறத பத்தி, குழந்தைங்களோட மென்டல் டெவலப்மெண்ட் பத்தி. பட் இன்னைக்கு ஸ்பெசிபிக்கா டான்ஸ்னால வர இன்ஜுரிஸ், டான்ஸ்னால வர பெனிஃபிட்ஸ், அதுல வர நல்லது கெட்டது, அதை பத்தி தான் இன்னைக்கு மெயினா டிஸ்கஸ் பண்ணியிருக்கோம். இதுல வந்து நம்ம பார்த்தோம்னா டான்ஸ் வந்து குழந்தைங்களுக்கு என்ன கொடுக்குது, என்ன ஒரு டான்ஸ் கத்துக்கிற ஒரு குழந்தைக்கும் டான்ஸ் கத்துக்காத ஒரு குழந்தைக்கும் உள்ள ஒரு வித்தியாசம் என்னங்கிறத ஃபர்ஸ்ட் பேசணும். அதுல வந்து முக்கியமா நம்ம பாக்குறது, ரிசர்ச் இது வரைக்கும் காமிச்சது என்னன்னா, டான்ஸ்ல ரெகுலரா பிராக்டிஸ் பண்றது, டான்ஸ்ல ரெகுலரா பார்ட்டிசிபேட் பண்ற குழந்தைங்களுக்கு வந்து பேலன்ஸ் பண்றது, ப்ராப்ரியோசெப்ஷன் சொல்லுவோம். ப்ராப்ரியோசெப்ஷன் என்னன்னா, நம்ம உடலோட நம்ம எங்க இருக்கோன்ற ஒரு உணர்வு. கண்ணை மூடிட்டு இருந்தா கூட நம்ம எங்க இருக்கோம்னு நம்மளுக்கு தெரியும். கண்ணை மூடிட்டு நீங்க கையை எடுத்து போட்டாலும் உங்களுக்கு உங்க ரூம்ல ஒரு பேனாவோ ஒரு பென்சிலோ எங்க இருக்குன்னு உங்களுக்கு தெரியும். அது வந்து உங்க உடலோட ஒரு அவேர்னஸ். அந்த அவேர்னஸ் வந்து இம்ப்ரூவ் பண்ணுது, அந்த பேலன்ஸ் இம்ப்ரூவ் பண்ணுது. ஒரு சிங்க்ரனைசேஷன், ஒரு குரூப்பா ஒரு எஃபர்ட் எடுக்கிறோம்னா அதை ஒரே மாதிரி பண்றதுக்கோ, இல்ல உங்க பாடியிலேயே ரைட் ஹேண்ட் லெஃப்ட் ஹேண்ட் சிங்க்ரனைசேஷன், இது எல்லாமே குழந்தைங்களுக்கு, டான்ஸ்ல இருக்கிற குழந்தைங்களுக்கு வந்து இல்லாத குழந்தைங்களை விட கொஞ்சம் அதிகமாவே இருக்குன்றதுதான் முதல் பாயிண்ட் நாங்க பேசினது. ரெண்டாவது பாயிண்ட் என்னன்னா, இந்த இன்ஜுரிங்கிறது வந்து எல்லா ஸ்போர்ட்லயும் நடக்கும். டான்ஸ் ஒரு ஸ்போர்ட்ங்கிறத மறந்துடாதீங்க, டான்ஸுமே ஒரு ஸ்போர்ட் தான். சோ எல்லா ஸ்போர்ட்லயும் இன்ஜுரிங்கிறது நடக்கும். அது ரொம்ப நார்மல். அதை கண்டு பயப்பட தேவையில்லை. அது இன்ஜுரியை வந்து எப்படி ஹேண்டில் பண்ணும், இன்ஜுரியை வராம எப்படி பாத்துக்கணும், இது எல்லாமே நம்ம ஒரு அவேரா இருந்து அதை ரெகுலரா ஃபாலோ அப் பண்ணிக்கிட்டே இருந்தோம்னா அதை பார்த்து பயப்படவே தேவையில்லை. இதுதான் ஃபர்ஸ்ட் திங். நாங்க 3 செஷன்லயும் இதேதான் சொல்லிட்டு இருக்கோம். இன்ஜுரிங்கிறது நார்மல். சோ டான்ஸ்ல வர இன்ஜுரிஸ் நம்ம பார்த்தோம்னா, முக்காவாசி இன்ஜுரி வந்து ஓவர் யூஸ் இன்ஜுரி, அதாவது அதிகமா திரும்ப திரும்ப செஞ்ச மூவ்மெண்டே செய்யறதுனால வர இன்ஜுரிஸ். அது வந்து நம்ம அவேரா இருக்கணும். அந்த இன்ஜுரிஸ் வந்து நம்ம அந்த மாதிரி ஒரு ஓவர் யூஸ் பண்ணாம, ஒரு போன செஷன்ல பேசணும் இல்லைங்களா, அந்த மாதிரி ஒரே ஒரு மூவ்மெண்ட்ல மட்டுமே போக்கஸ் பண்ணிட்டு இல்லாம, நம்ம ஸ்பெஷலைஸ் பண்ணாம வேற மூவ்மெண்ட் பேட்டர்ன்ஸ் கொடுத்து, ஸ்ட்ரென்தனிங் சைட் பை சைடு கொடுத்து பண்ணோம்னா அந்த இன்ஜுரிஸை குறைக்கிறதுக்கு ஒரு வாய்ப்பு இருக்கு. விழுந்து வர கீழே விழுந்து வர இன்ஜுரிஸ் அதெல்லாம் அவாய்ட் பண்ண முடியாது. பட் இந்த மாதிரி இன்ஜுரிஸ் நம்ம கண்டிப்பா அவாய்ட் பண்ணலாம். நம்பர் 1. நம்பர் 2 வந்து இப்ப பேலேலயும் கண்டெம்பரரி டான்ஸ்ல என்னென்ன டிஃப்ரெண்ட் டைப் ஆஃப் இன்ஜுரிஸ் வருதுங்கிறதையும் பார்த்தோம். அதை எப்படி ஹேண்டில் பண்றதுங்கிறதையும் பார்த்தோம். இதுல முக்கியமான விஷயம் என்னன்னா, ஒரு இன்ஜுரி வரதுக்கு மோஸ்ட் காமன் ரீசன் வந்து என்னன்னா, பேலே ஆர் எனி டான்ஸ் ஃபார்ம் நீங்க எடுத்தீங்கன்னா, ஏஸ்தட்டிக் ஸ்போர்ட்னு சொல்றது, அதாவது நமக்கு பார்வையில வந்து நமக்கு பாக்குறதுக்கு எதமா இருக்கிற ஸ்போர்ட் இது எல்லாமே. சோ இந்த ஸ்போர்ட்ஸ்ல வந்து எப்படின்னா, அந்த ஆத்லீட்டுக்கு வந்து தன்னோட பாடி வெயிட், பாடி எடை குறைவா இருக்கணும்ட்டு தான் மைண்ட்ல ஓடிட்டு இருக்கும். அவங்க வந்து பாக்குறதுக்கு அந்த ஒரு பர்டிகுலர் லுக், ஒரு பேலே டான்சர்னா ஒல்லியா ஒரு குச்சி மாதிரி இருக்கிறது தான் நமக்கு யூஸ்வலா ஒரு மைண்ட் செட். சோ அந்த மைண்ட் செட்ல அவங்க இருக்கணும்ன்றப்போ அவங்க என்ன பண்ணுவாங்கன்னா, அவங்க சாப்பிடுறத கம்மி பண்ணுவாங்க, கேலரி டெபிசிட்ல போவாங்க. இதுல போறதுனால அவங்க பாடியில நிறைய ஹார்மோன் சேஞ்ச் வரும், ஹார்மோன் இம்பேலன்ஸ் வரும். அதனால அவங்களோட எலும்புகள், போன்ஸோட ஸ்ட்ரென்த் குறையும். சோ இது எல்லாமே வந்து நம்ம மைண்ட்ஃபுல்லா இருக்கணும். இது என்ன பண்ணணும்னா, நம்ம வந்து குழந்தைங்களுக்கு வந்து இந்த மாதிரி போகும்போது, ஓகே உங்களோட கிளாஸ்ல எல்லாருமே ஒல்லியா இருக்காங்க, நீங்களும் வந்து அப்படி இருக்கணும்னா ஹெல்த்தியா எப்படி அதை பண்ணலாம். நம்ம வந்து சாப்பிடாம இருந்து, கம்ப்ளீட்டா சாப்பிடாம இருந்து, ஒரு நாளைக்கு ஒரு வேலைக்கு தான் சாப்பிடுவேன்ற மாதிரி குழந்தைங்க அடம் பிடிக்கிறாங்கன்னா விடாம அந்த குழந்தைக்கு ஹெல்த்தியா எப்படி வெயிட்ட குறைக்கலாம் அப்படிங்கறத சொல்லி கொடுத்து, அந்த இட்ஸ் ஓகே, அந்த டான்ஸ் ஃபார்முக்கு உனக்கு இப்படிதான் இருக்கணுமா, அதை நம்ம எப்படி கரெக்டா அடையலாம் அப்படிங்கறத மைண்ட்ல வச்சுட்டு வளர்த்தோம்னா இந்த மாதிரி இன்ஜுரிஸை நம்ம கொஞ்சம் அவாய்ட் பண்ணலாம். இது மட்டும் இல்லாம ஒரு குழந்தைக்கு இப்ப இன்ஜுரி இது எல்லாத்தையும் தாண்டியும் வரலாம், வந்தா அது நார்மல். அப்படி வருதுன்னா இன்னொன்னு நம்ம மைண்ட்ஃபுல்லா இருக்க வேண்டிய இன்னொரு விஷயம் என்னன்னா, அந்த இன்ஜுரியில இருந்து பிசிக்கலா அந்த குழந்தைய விடுபட்டு வெளில வர்றது ரொம்ப ஈஸி. பிசிக்கலா நம்ம ட்ரெயின் பண்றதோ, ஒரு ஐசிங் வைக்கிறதோ, ரெஸ்ட் கொடுக்கறதோ எல்லாம் ஈஸியா பண்ணலாம். ஆனா அந்த குழந்தைக்கு அது மன அளவுல பாதிக்கும். மறுபடியும் அதே ஒரு மூவ்மெண்ட்டையோ அதே ஒரு விளையாட்டையோ போய் ஆட சொன்னா அந்த குழந்தைக்கு ஒரு பயம் வர்றதுக்கு வாய்ப்பு இருக்கு. வராமலும் இருக்கலாம், 100% வரும்னு நான் சொல்லல, பட் வர்றதுக்கான வாய்ப்பு இருக்கு. அந்த பயத்தை நினைச்சு நம்ம கொஞ்சம் அவேரா இருக்கணும். கொஞ்சம் அந்த குழந்தைக்கு அந்த இடத்தை கொடுக்கணும், அந்த குழந்தைய பேச விடணும். நம்ம அந்த குழந்தையோட பேசி ஒரு தைரியத்தை கொடுக்கணும், மன தைரியத்தை நம்ம கொடுக்கணும். அந்த குழந்தைக்கு வந்து இல்ல உன்னால முடியுங்கிற அந்த ஒரு கான்பிடன்ஸை நம்ம கொடுக்கணும். இது எல்லாமே தான் நம்ம இன்னைக்கு மெயினா பேசின டாபிக்ஸ். இது இல்லாம ஃபைனலா ஒரே ஒரு பாயிண்ட்னா அசஸ்மெண்ட். நம்ம வந்து ஆஸ் பேரண்ட்ஸ் தினமும் உங்க குழந்தைய கவனிங்க. உங்க குழந்தைங்க வலின்னு ஏதாச்சும் சொன்னாங்கன்னா அது என்னன்றத கொஞ்சம் தீர விசாரிங்க. வாரத்துல ஒரு நாள் ஆச்சு உங்க குழந்தையோட உட்கார்ந்து இந்த வாரம் எப்படி இருந்துச்சு, எங்க என்ன ஆச்சு, உங்க உடல் எப்படி ஃபீல் ஆகுது, உங்களோட பிரீதிங் எப்படி இருக்கு, ஏதாச்சும் கஷ்டம் இருக்கா, ஏதாச்சும் நல்லா இருக்கிற மாதிரி ஃபீல் ஆகுதா, எல்லாத்தையுமே கேட்டு வாரம் வாரம் அதை நோட் பண்ணுங்க. ஏன்னா வளர்ற குழந்தைங்களுக்கு நிறைய புதுசு புதுசா நடக்கும். நம்ம வளர்ந்து பெரியவங்களுக்கு இருக்கிற மாதிரி இருக்காது. சோ நம்ம அதை வாரம் அதை நோட் பண்ணிக்கிட்டே வந்தாதான் நம்மளுக்கு ஒரு வேளை ஒரு இன்ஜுரி ஆகுதுன்னா அதுக்கு முன்கூட்டியே தெரிய வரும். ப்ரீஹாபிலிட்டேட் இன்ஜுரி வர்றதுக்கு முன்னாலேயே நம்ம அந்த குழந்தைய ரீஹாபிலிட்டேட் பண்ணி தயார் பண்ணலாம். சோ இன்னைக்கு பேசினது இதுதான். ஓவர் டு பிரேரணா.
Over to Prerna. Okay. So that was very good, Dr. Harini. Not that I understood a word of it. It was so fluent and I heard mostly there. What I have realized that I cannot translate this into Hindi because my Hindi is very limited and the words here are very
Trust me, I use so much English as well.
Yes, calorie deficit, mind-body connection, assessments. I don't know the Hindi words for that. So what I'm going to do is I'm going to write my script, translate it into Hindi, and then I'm going to do a separate video and upload it.
Okay.
So हमने आज डिस्कशन किया है, हमारी आज बात हुई है इंजरीज के बारे में, स्पेसिफिकली बैले और कंटेम्प्रेरी डांस. काफ़ी बातें हुई हैं इस पर कि बच्चों की बैले और कंटेम्प्रेरी ट्रेनिंग से अगर इंजरीज होती हैं उनको कैसे मैनेज करना है, कैसे प्रिवेंट, कैसे इंजरीज ना हो उसके लिए क्या करना चाहिए. पर ये जो डिस्कशन है ये मोस्टली इंग्लिश में है. ये मुझे हिंदी में लिखकर स्क्रिप्ट बना करके फिर वीडियो मैं बाद में अपलोड कर दूंगी. Because right now I can't. I just can't. On the go मुझसे नहीं होगा. This is a really difficult topic and very technical.
Yes, it is.
Very technical. The world is laughing at me. Okay, well, it was lovely having you, Dr. Harini here. And I know quite a bit, but I still learned so much today. And I really hope that parents and dance studios and teachers have their own takeaways from our discussions, because the expectations are quite unrealistic, I feel sometimes, like expecting 5-year-olds and 6-year-olds to do a pirouette. I mean, sometimes parents come to us and they have this in their mind that I saw a professional ballet performance somewhere in a video, and okay, so when is my kid going to dance like that? It takes years of study with several hours of training every day, and focused trainings which come at a cost of other things. You can't be excellent in academic work and still do ballet. Maybe 1 or 2 people in the world, but it's usually not the case. It doesn't happen. So that expectation that the child should be able to do a pirouette by the time they're 6 or 7 is very unrealistic. So the training is very progressive, and it needs to be so, because it's just like how you put your kid in a school at 5 years of age or at 3 years of age. By the time they're in 5th or 6th grade, they've just started to write basic sentences, and sometimes not even that clearly or well. And that again, this differs from child to child, like how they write it. So just as it is with any academic studies that requires the mind working, same it is with the body, that it takes time. The study needs to be progressive, and every child's learning trajectory is going to be different. The important thing is consistency. Consistency is key. Progressive overloading is key. Preventive measures so that injuries are less likely. We cannot entirely remove the likelihood of it, but we can take care that they don't happen. And unless the child wants to take it to a professional level, so if we are only talking recreational ballet and contemporary dance studies, just to move and take it so far, and then let the child explore later in their college how they want to take it, be a little conservative in how much you're pushing your kid to practice. So after give that message to the parents, Indian parents, I would like to thank everybody for being here, viewing our conversation. Thank you so much, Dr. Harini, and for sharing your knowledge. And if you ever wish to apply for a dance teacher's job, if you have any interest in dancing, please let me know. I'll get you trained, and I'd love to hire you. That degree of knowledge and
I'd be glad to work with you as a physician itself.
I know. And that is going to happen for sure.
Yeah.
Yeah. So thank you and have a good night.
Good night.
Bye.
Bye.